Cognitive behavioral therapy has a number of advantages. Obviously, it does not introduce the metabolic and side effect burden of medications. Number two, it tends to have a longer acting effect. So many months and even years after the discontinuation of cognitive behavioral therapy, we see evidence of continued efficacy with insomnia. It still works up to 1 or 2 years after therapy has been completed. Whereas this is not something which we see with hypnotic medications or sleeping pills. They stop working very quickly after discontinuing the medication. Number three, cognitive behavioral therapy is especially in older individuals, does not introduce many of the cost risks associated with medications, and cost factors are significant in older individuals. On the other side of the equation, the disadvantages of cognitive behavioral therapy are that the number of therapists that are available and trained well to do the therapy are few and far between, unfortunately. And some of them don't have adequate insurance coverage. So the other disadvantage of CBT, or cognitive behavioral therapy, is that it tends to not work quite as quickly as pharmacotherapy. So if there are individuals who need rapid treatment, that may be the less appropriate approach. Finally, CBT is much more appropriate in individuals who have multiple medical conditions and who have multiple drugs on board, because the data clearly show that these folks are better treated and the treatments are more effective when CBT is the choice over pharmacotherapy. So mindfulness techniques and mind-body relaxation techniques are useful, of course, for individuals who have a high degree of arousability. And arousability or brain activation is common in many insomniacs. So muting that or diminishing that activation may be very helpful. So yoga, tai chi, biofeedback, meditation, these all may be helpful and have shown to be helpful in a variety of conditions, including anxiety disorders and so on and so forth. So I do think they're useful, they're helpful. Again, the question is, are there enough trained therapists to do these? And the length of time that it takes to do these things and to implement them may be a problem for some older individuals. There are many substances that are available to insomniacs without a prescription, such as the over-the-counter hypnotic medications. These typically are in the realm of diphenhydramine and doxylamine, the antihistamines. And there are many other compounds that are so-called natural compounds, nutraceuticals, which are available as well. We find that many insomniacs have tried these compounds before they see a physician. The advantages of these agents, of course, or at least the perceived advantages, are that they're cheap, they're available without a prescription, they're readily available to anyone who wants to use them, and they have the allure of having fewer side effects or fewer burdens to the patient. Unfortunately, most of these agents have not been well studied or well researched in clinical settings, and many of them may have side effects which are not well known. The concern, of course, is that by combining many of these agents together, we may produce toxic metabolic effects and as well as CNS effects, which people may not be necessarily aware of. So we always recommend to older individuals that they use these agents judiciously and report them to their physicians so that we at least have a knowledge of what they're on. One of the commonly used medications is melatonin. Melatonin is a neurohormone which is naturally secreted and which is thought to regulate sleep and circadian rhythms. And there are many formulations available. Meta-analytic data have shown that melatonin has very modest positive effects on sleep latency and sleep maintenance. So it may help people fall asleep more quickly by the order of a few minutes and maybe sleep a few minutes longer. So its effects don't seem to be all that striking, all that impressive. And the problem with melatonin also is that we just don't understand its side effects. There's some fairly well done data suggesting that it increases glucose resistance and may also increase insulin production with less insulin effects on target tissues. So I think the use of melatonin may be a good practice in some cases, but we don't understand its side effects well. Finally, melatonin formulations vary quite a bit, and there's no regulation of its use by the Food and Drug Administration. So these natural products are available, widely utilized. We just don't quite understand if they have a positive effect or what effects they do have, and more importantly, what their side effects are. So I think in a complementary health approach, important points are to ensure that we know what agents the patients are using. Number two, to ensure that the ones they're using have at least some data suggesting their usefulness. And number three, at least that we understand what some of the side effects are of these medications, and to advise patients that little is known about these and to use their judgment about the prolonged use.